You probably grew up thinking Sue the T-Rex was a perfect predator. Chicago's $1 million dinosaur, jaws agape, plush toy in the gift shop. But that is not the story hiding behind those famous skull holes. In 2009, paleopathologists discovered those holes were not bite wounds at all. They were evidence of a parasite that choked Sue from the inside out. This is a disease museums never mention, despite forensic proof. If the T-Rex on display hides the reality of slow starvation and chronic pain, what else are museums leaving out? Let's start with the hole in the narrative and dig into what Sue's bones really say about the dinosaurs we thought we knew. Picture at the back half of Sue's lower jaw. A patchwork of holes, some nearly the size of a golf ball, spread across the bone. Visitors used to hear a neat story about battle scars, the aftermath of a T-Rex versus T-Rex fight. Great for the gift shop, great for a plush toy. But if you like detective work and calipers, the story gets weird and a little bit fun. First, let us line up the bite theory. Tyrannosaur jaws are not subtle. Big teeth. Regular spacing along the row. If another T-Rex clamped down on Sue's face, you would expect a neat row of punctures, each hole matching the distance from one tooth to the next. Try this in your head. Or better, buy a model Tyrannosaur jaw at the museum gift shop. Hold it up next to the pattern of holes on Sue's real fossil. Does it match? Not even close. The holes are clumped and irregular. They refuse to line up with any known dental arcade. Some are bunched together, others are spaced out. It looks like a dentist with a grudge and no sense of symmetry went to work. This is not just a trick of the eye. Paleontologists have searched for a pattern, any pattern, that fits a bite. They come up empty. No row, no arc, no even rhythm, just a scatterplot of misery. And these are not shallow pits or scratches from a glancing blow. These are through and through holes, with no obvious match to a full set of teeth. So what is left? Not a rival's bite, at least not one that makes geometric sense. The spacing is wrong. The holes do not tell the story of a single traumatic event. They tell a different story entirely. That is why the bite theory began to wobble. If the geometry does not fit, you have to ask, what else could punch holes in a T-Rex jaw and leave them in such a messy, unrepeatable pattern? The answer is not obvious, and that is the point. The more you measure, the less the old story holds up, which means it is time to go smaller, down to the microscopic level, to see what the bone itself has to say. The details hiding inside the bone will tell us whether these holes were made by teeth, by growing infection, or by something else entirely. And that turns a museum legend into a medical mystery worth solving. Inside the lab, the real detective work starts with a microscope and a thin slice of fossilized jaw. This is where the story stops being about pretty holes and starts being about bone, cell by cell. The 2009 Wolf study is the headline act here. Instead of guessing from the outside, Wolf's team compared Sue's jaw lesions to those in other tyrannosaurs and to birds fighting a protozoan parasite called Trichomonosis gallinae. That comparison changes the narrative. The edges of Sue's jaw holes are not jagged like a fresh bite. They are scalloped and smooth, the kind of margin you get when bone is slowly eaten away over time. That pattern points to chronic disease rather than a single traumatic event. Pathologists call those resorption bays, called house-ship lacunae, where bone cells dissolve tissue from the inside out. It is the bone surrendering to something it cannot fight, a parasite settling in for the long haul. There's another clue in the bone itself, the transition from woven bone to lamellar bone. Woven bone is the body's emergency patchwork, fast and messy and laid down in a rush. Lamellar bone is slower and more organized, the normal stuff. When you see both layered together at the lesion margins, you are watching the body trying to wall off a Chronic infection. In modern birds with trichomonosis, the parasite burrows into the soft tissues of the throat, and when the infection becomes severe, it can eat into bone, creating holes with exactly these kinds of margins. So, under the microscope, the old story of a violent bite keeps falling apart. The pattern, the bone response, and the microscopic texture all stack up for long-term smoldering infection. This is not just a T-Rex with a few scars. This is a patient with a chronic illness, and the jaw is only the first page of the medical record. Picture Sue's ribs for a moment, not the sleek museum version, but the real fossil, full of lumps and knots. At least a few ribs are bent and thickened, with big knobby calluses where the bone broke and then tried to glue itself back together. That is not a design feature. That is what happens when a 40-foot animal takes a hit, hard enough to snap a rib, maybe from a fall, maybe from a struggle with armored prey, and then survives. In humans, a broken rib means weeks of pain every time you breathe. For Sue, it meant months, maybe years, of every breath reminding her of that injury. The healing callus is the body's emergency patch job, messy, oversized, and impossible to miss once you are looking for it. Some of these calluses are so pronounced they bulge out from the rib in a thick mass, a permanent record of trauma and survival. Move down the backbone and Sue's tail reads like a radiology report from a demolition derby. About halfway down, two tail vertebrae are fused into a single blocky unit. The joint between them is gone, replaced by a mass of irregular bone that wraps both vertebrae and even the little chevron bone underneath. That is chronic osteomyelitis, a bone infection that set in after injury and then slowly cemented the vertebrae together. This is not a quick fix. It takes months, even years, for bone to lay down that much new tissue, especially in an animal the size of a bus. The result is a tail that lost flexibility, probably hurt to swing, and would have made fast turns a lot harder. Fused vertebrae tell you the tail was disabled and likely painful. Add arthritis in the neck and back, and you start to see a pattern. Sue was not just a survivor, but a patient. These injuries did not kill her, but they did not leave her unscathed either. Every callus, every fused joint, is a fossilized reminder that life for a Tyrannosaurus rex was less unstoppable predator and more long-term rehab patient with a bad attitude. The museum display is all power and poise. The bones tell a story of pain, recovery, and the kind of resilience you do not get from a plush toy. Sue did not just survive the Cretaceous, she survived herself, one injury at a time. Sue's left fibula tells a story most would miss. The bone is swollen to nearly twice the diameter of the right, a difference that leaps out even through fossilized remains. For years, the assumption was a healed fracture, but CT scans reveal something else entirely. There is no break, no fracture line. Instead, the cortex, the bone's dense outer shell, has thickened in a pattern unmistakable to radiologists: chronic osteomyelitis. This was not a single traumatic event, but a persistent bacterial infection, gnawing away over months or years. The infection forced the fibula to remodel itself. CT slices show regular layers of new bone, patchy and rough, built up around the original shaft. The periosteal surface, normally smooth, looks as if it was constantly being rebuilt, the body's immune system trying to contain the infection. The result is a bone that is lumpy, misshapen, and thick, but still managed to function. This is not a fossilized moment of injury, it is a record of a body locked in a long battle, fighting to keep moving while bacteria worked from within. Muscle attachments around the fibula bear their own scars. Enlarged, roughened marks show where tendons tore and healed, evidence of repeated strain. Each step would have sent pain up the leg, with swelling pressing on nerves and blood vessels. In humans, chronic osteomyelitis brings years of limping, fever, and exhaustion. For Sue, it meant a permanent limp, a body forced to adapt to a leg that never fully recovered. Pain shaped every stride. The medical portrait is stark. A jaw pitted with holes, ribs that broke and healed, a tail fused by infection, and now a leg bone warped by years of disease. Sue was not just a predator, but a survivor of chronic illness. Her bones a silent record of endurance. The pain and infection may be invisible in the museum, but the evidence is written in bone. Trichomonosis is the kind of disease museums barely mention, but in the clinic, it steals the show. Picture a red-tailed hawk brought in by wildlife rehabbers. The bird is alert, still fierce, but there is a yellow mass growing in the back of its throat. That is the calling card of Trichomonas gallinae, a protozoan that infects birds from pigeons to falcons. It starts small, a little swelling, a bit of drool, maybe trouble swallowing. But the parasite does not stop at discomfort. It burrows into soft tissue and forms cheesy, necrotic plaques that block the glottis or the esophagus. For the bird, it is like trying to eat with a cork jammed in your throat. Food piles up in the mouth, weight falls off, and the bird grows weaker by the day. In small raptors, death by starvation can come in as little as 8 to 12 days if the infection is not caught and treated. No drama, no cinematic predator-prey showdown, just a slow, relentless suffocation by a microscopic invader. The parasite itself is invisible without a microscope, but its work is impossible to miss. A throat packed with dead tissue, a body wasting away surrounded by food it cannot swallow. In modern birds, this is a common story. Rehab centers see dozens of cases every year. The mechanism is straightforward. Parasite invades, tissue swells, airway closes, and the animal starves. No villain, no bite marks, just a protozoan with a simple, devastating playbook. Sue's bones aren't outliers in the fossil record. They're part of a bigger, messier pattern. Hell Creek is not just a graveyard for the bold and the bitten. It reads more like a medical archive for the chronically ill. When paleontologists started cataloging pathologies, the numbers got hard to ignore. Multiple tyrannosaurids from the same formation show strikingly similar jaw lesions. Wolf's 2009 study put CUE alongside MOR 980 and B. rex, all with matching holes in the back of the jaw. That is not a freak accident. It is a trend. And it is not just tyrannosaurs. The Berlin T-Rex Tristan Otto underwent a computed tomography scan in 2021 and revealed a lower jaw riddled with infection, osteomyelitis, not a clean injury. In Alberta, a Centrosaurus fibula sat in a museum drawer for decades until a 2020 study diagnosed full-blown osteosarcoma. That is dinosaur bone cancer, confirmed by the same imaging and pathology standards used for human patients. Meanwhile, South American sauropods, giants from Brazil, turned up with chronic bone infections so severe that some never healed at all. Different continents, different clades, same story. Disease left its mark everywhere. No one has pinned down a perfect percentage, but the trend is clear. Pathologies, fractures, infections, tumors show up in a sizable chunk of Hell Creek fossils. In some samples, nearly a third of individuals show at least one major disease marker. The bones are shouting about a world where chronic illness was routine. Yet, when you walk through a dinosaur hall, you will not see a single display boasting that. Museums do not advertise 30% more bone infection. The reality is, Sue was not the exception. She was the rule. $8,400,000. That is what it took to buy a dinosaur. Not just any dinosaur. The most complete Tyrannosaurus rex ever found. Catalog number FMNHPR2081. Better known as Sue. In 1997, the Field Museum did more than outbid rivals. They staged a full-blown fossil Super Bowl at Sotheby's, with McDonald's and Walt Disney World Resort footing much of the bill. If you are picturing a hushed room of paleontologists, think again. This was corporate logos, velvet ropes, and a media circus. The final gavel hit at $8,400,000, a record that made Sue more expensive than most paintings, let alone prehistoric bones. The museum press team wasted no time. Sue became the crown jewel, the king of the dinosaurs, the symbol of Chicago's scientific muscle. Board members called it an investment in wonder. For that price, you do not just buy a fossil, you buy a brand. And the brand had one job: fill the halls, sell the plushies, and make the donors look like visionaries. The acquisition was not about medical history or messy disease. It was about spectacle. Sue was reintroduced to the world as the ultimate apex predator, an $8,400,000 monument to power and perfection. Every press release, every donor plaque, every opening gala leaned on that story. The science came later. The first act was pure theater, and the tickets were paid for by the biggest names in fast food and family entertainment. That is how you turn a sick, battered animal into a museum icon. One auction, a pile of corporate checks, and a promise that this T-Rex would inspire, not depress, the next generation. Walk up to Sue in the Field Museum, and the first thing you will see is the label. Big, bold, and packed with superlatives. Most complete T-Rex. World's largest predator. Bite force 8,000 pounds. The label mentions injuries, but it is buried in a block of smaller font, somewhere between the fun facts and the donor shoutouts. The word parasite is missing. Infection gets a passing nod, usually as a vague pathology. If you are looking for a breakdown of Sue's medical chart, you are out of luck. There's more detail on the gift shop map than on what actually happened to this animal's body. Wander over to the merchandise. The plush Sue is a masterclass in branding. No jaw holes, no lumpy ribs, not a hint of arthritis. Just a soft, symmetrical face and a winning grin. For $30, you get the apex predator, airbrushed, sanitized, and ready for Instagram. The only thing missing is a little embroidered tag saying now with 100% fewer chronic diseases. Meanwhile, the research collection holds drawer after drawer of bone photographs, lesion close-ups, and CT scans, and none of that makes it onto a mug or a t-shirt. Gift shop Sue sells. Research Sue stays locked away. Posters, puzzles, and even the official Sue action figure all show a flawless animal. The message is clear: power sells and vulnerability does not. The museum public story is a highlight reel. The medical file is for scientists, off stage. You can visit Selby 100 times and never see the word parasite in print. The holes are hidden in plain sight, while the gift shop is always front and center. That is the choice being made every time a label is written and every time a plush is produced. Every time a museum hides a lesion or erases a parasite, it shapes how we imagine deep time and what we expect from science. Sue's suffering is not just prehistoric trivia, it is evidence that truth gets curated even now. Real fossils do not fit gift shop stories. The next time you visit a museum, look past the display, because the bones still tell their own version. Tell me what you find at your local museum.